The COVID-19 virus takes a physical and emotional toll on many survivors. Anxiety, depression, substance abuse and even self-harm are some of the mental health issues survivors may struggle with. So how do we help them? Joining me now to unpack this is psychiatrist Dr Alicia Porter. Thank you very much, Dr Porter, for your time. So COVID-19 has necessitated that we also reimagine our approach to mental health care. What specifically needs to change?
Good afternoon. I think the whole system needs to change. We need to begin to find more creative ways. And also we need to learn how to adaptively navigate, because I think the one thing that COVID has done has brought to the fore our mental health. I think they were always there. The system was overrun and overburdened, and it just was not adequate to deal with our previous situation, and COVID has just unmasked this. So we need to begin to find new ways as to how we are going to overhaul the healthcare system, particularly mental health, with all the shortages that we currently have.
So COVID-19, as you've said, has also highlighted social disparities. Also in the mental health care access. How accessible is mental health care in the public sector specifically?
So mental health care in the public sector is very inaccessible at this point in time. There are 1 in 3 or 30% of South Africans who will have mental health conditions. Of those, 25% will have severe mental health conditions. And of those, a very small percentage actually would access mental health care services. For example, in the public sector, or at least in South Africa, there are less than 1,000 psychiatrists. And of those less than 1,000 psychiatrists, only 1/3 of them work in the public sector. So there's kind of like 0.3 psychiatrists per 100,000 of our 55 million population.
When we look a little bit more closely at the private sector, does health insurance provide adequate cover for mental health care, even for those who have more means to access it?
So with private healthcare, most medical aids will give you 21 days as an inpatient, and if you don't use that benefit, it may give you 15 days as an outpatient. A lot of the mental health conditions are chronic conditions. Not all of them are necessarily severe conditions, but you have your severe and then you have your common mental health conditions. And that is not enough, in order to manage a chronic condition. Also, only 16% of the population has medical aid, which is a very alarming or very disheartening statistic.
So across the board, inadequate access to proper mental health care. The system is not capacitating mental health care providers to be able to reach the people who need them. With fears building of serious long-term mental health impacts, such as memory problems and neurological disorders, just to limit, to mention a couple, resulting from COVID-19, how does the public health system need to make provision for better access to treatment now?
So, I think the healthcare system needs to begin a process of first creating awareness, because a lot of the time, the biggest problem with mental health is that it goes undetected. That would be the first issue, is how do we create awareness? Secondly, it's about how do we begin to upskill communities? There was a whole move for deinstitutionalization here in South Africa and making our healthcare more accessible at community level. But we haven't really moved beyond the idea of what this should look like. So it's got to be where we invoke the help of civil society, the NGOs, and just how do we provide good mental health care at a community-based level. Just care, services, awareness. It needs to begin within the communities, because that's where we would have the biggest impact, is in the communities. Because the psychiatric facilities, for example, they are mainly, particularly in the public sector, they are mainly geared towards severe mental health conditions.
Community resources are often under-resourced. NGOs simply do not have the funds to get to everyone. Those resources need to come from a national health level. But we know our health department at this moment is absolutely hamstrung by trying to get vaccines to everyone. They're not going to have the capacity to address mental health adequately within the next couple of months. So is there another solution?
You know, it needs to be, with the pandemic, there are three responses. We had a medical, the medical response and the economic response, that was swift. The psychological response needs to happen. We need to begin to see how, because that response or that impact is a lot, it's far reaching. So once you've got your vaccine, wonderful. But what happens to the psychological impact? It doesn't change the fact that there's been multiple losses, lives lost, jobs lost. There's been multiple, isolation, where I think the cure sometimes feels worse than the disease. So, there needs to be pressure, as it can't be abdicated. It needs to be part of our COVID-19 response, needs to be the response with regards to what do we do with the psychological impact of the virus, which is going to be felt far into the future. It's going to have far-reaching consequences. So yes, while we are looking at rolling out the vaccine and all of those things, actually the psychological response needed to be part of the response to the COVID-19 vaccine as a priority.
Apologies. Thank you very much for your insights. That was Dr. Alicia Porter talking to us about the dire need for more attention given to mental health care in the wake of COVID-19.